Happy Friday, everyone. We're doing another doctor series right now, and I'm very excited because we have Dr. Joseph DeSanto on today. He is an addiction specialist from the Beat Recovery Program. Dr. Joseph, thanks for coming on today.
Hi, thanks for having me.
Absolutely. So tell us a little bit about what you do and what exactly is the Beat Recovery Program?
So it's actually beat addiction. Um, we don't want to beat recovery. Well, we want to beat recovery into people
There you go.
in a nice gentle way. But it's beataddiction.com. So I'm an addiction specialist. I'm in Costa Mesa in Orange County, California, which is one of the heartlands of addiction and addiction treatment. And I didn't plan it that way. It's where I got sober myself, and it's where I laid down the roots of my own sobriety. And it's where I decided to put up an office and take care of people like myself. And the rest is history.
And so through your own personal experience, is that what led you to want to go into this type of specialty?
Well, believe it or not, when I was deepest in my addiction, I was actually still practicing addiction medicine, not quite the way it was supposed to be practiced, but I was laying down the groundwork, I guess, for what was about to come, which was my own sobriety, my own getting sober, and then actually taking it seriously, becoming board certified, and and then opening a practice purely in addiction medicine, which not a lot of people do that. It's a very niche specialty, and it's as you can imagine, your patient population doesn't stick around for very long.
Absolutely. And what are some of the most common addictions that you do treat right now?
Well, one of the most common addictions in our neck of the woods, and unfortunately in a lot of neck of the woods around the world, the United States especially, is the opioid epidemic, and we are seeing it, playing out in so many forms lately, especially in the forms of fentanyl, which is soundly taking over the heroin addiction market that's been going on in Southern California. And unfortunately, fentanyl is hard to argue with. If you're an opiate addict and if you've got the right brain for liking opiates, enjoying opiates,
Mhm.
once you meet fentanyl, you forget about your other friends.
So that's really tough. And if you noticed an increase in terms of addictions due to the pandemic, how do you think that's kind of pivoted your business?
That's a really good question, and I've been going back and forth since we've started the quarantine. In California, it's been pretty rigorous compared to other states. We've been bearing the brunt of a very overprotective government, and that's the good and bad with that, unfortunately. And the bad is that there's been a lot of increased isolation. So with that, we've especially seen increases um, in mental illness that goes hand in hand with most addictions. And they've actually, some good studies have just come out that show that bipolar disorder and schizophrenia are the two main mental illnesses, axis one diagnoses, which are on the rise and seem to be worsening with increased isolation. You can imagine schizophrenia would be like that. And with both of those come a host of addictions. Usually self-medication of a co-occurring disorder increases the likelihood of making your primary substance use disorder worse. And that's what we're seeing. We're seeing it as a result of that. And then, you isolate people,
Mhm.
and in the best of situations, when we're all socially together and not distancing, addicts will distance themselves. Now, given carte blanche and given the ability to um, make that seem okay, socially acceptable, there's been no one to tell them, no accountability that that's not the right thing to do. So we've got a lot of people isolating and being told to do that, and with that, you've got a lot of people making decisions on their own. And when somebody's in their addiction, that's usually not good decision making.
And so how do you treat addictions exactly?
Well, see, here's the thing. Most diabetics, most people with hypertension,
Mhm.
you treat them with a medication, and people take their medication. There's not a lot of There's not a lot of mental push and pull about whether you should be on an antihypertensive or not.
Mhm.
But if you approach someone with an addiction and they're not ready to, you don't have to admit you have hypertension to be treated for hypertension. Your blood pressure is 150 over 98. Okay, you need this medication, or it's been shown that this is going to happen. Somebody with an opioid use disorder, and you tell them that this is going to cause morbidity and mortality, you're going to die eventually from it
Right.
if we do not arrest the process. So you've got to have a willing population to treat it, and that's the surreal part of this disease. You can lead a horse to water, kind of thing.
Yeah, and so in a lot of those situations, have you seen where like their family has brought them in or they have admitted that they need help, or can it be kind of tough if they don't feel that they need help?
It depends on the age of my patients. I think the younger population and the married population and the patients that don't think they have quite a bad of a problem are usually brought in at the behest of a significant other or a family member, especially young kids. And adolescents and young adults seem to be driven by their parents or their cohorts. And as your disease progresses and you run out of your own choices and your family stops, quote unquote, caring about you or enabling,
Mhm.
I'm sure they always care about them. Um, you're left to your own devices, and when there's no other houses left, and there's one house at the end of the block, and it's got a little light on in the top, you're going to knock on that door. And unfortunately, that's how I see a lot of my patients. They're coming in with that kind of desperation. And that I've seen a lot more of lately since the lockdown.
And obviously, treatment can be lifelong. So, how often are your patients usually seeing you for before, perhaps they start to actually like get better? How long is that process? Is it different for everyone? And what have you seen in your career?
Yeah, it's different for everyone. I mean, that's the short answer. The long answer is if I'm doing my job, then they will be able to take it from whatever point they leave off with me, meaning they've got enough tools in their tool belt to handle what life can throw at them to maintain their own sobriety.
Mhm.
My specialty is I take care of patients in detox. Okay. I didn't learn that in medical school. I didn't learn that studying to be board certified in addiction medicine. I learned that on my own. And I learned that um, withdrawing from opiates so many times, and so many times I've relapsed, that I was one of the, if you want to consider it fortunate, I was one of the fortunate ones that got to run through the gamut of what works, what doesn't, what feels comfortable, what doesn't, how your addiction can lie to you, how. So there's a lot of moving parts here, and that's where I typically can help my patients the best. But to speak of addiction in general, it is a lifelong process. There are a few instances where people recover spontaneously, and some studies have shown it's up to 20%. I don't see those patients, unfortunately.
Right.
The spontaneous, remitters don't come to me. They may come to me with good news, 20 years later, and that's another thing. I don't get to see my patients do well, because once they do well, they kind of leave. It's like baby birds leaving the nest.
Oh.
I get to see patients. Unfortunately, I get to go to a lot of funerals. I get to go to a lot of 20-year-old funerals, and that's what's been really increasing these past couple of months. And being a father of a 20-year-old and a 14-year-old who are both what I know as sober, I can't imagine having to bury someone over this disease, and that's what keeps me going too.
Absolutely.
Yeah.
And so how do you deal with that? Because that is really heavy, in terms of a doctor and having to cope with attending somebody's funeral because maybe they didn't make it. How do you kind of balance that in your life?
Wow. How much time do we have?
We have a
Uh,
little bit.
well, in the beginning of my career, there was no self care. There was no. I didn't rely on, and I think this is a problem with doc physicians in general. We don't ask for help. We don't have a way to let off steam, and we don't have a way to process the trauma, whether it's direct or vicarious, for the things that we've gone through. I was a hospitalist in my early days, and I took care of a lot of patients in intensive care units, and just a lot of patients dying around me. And it became so commonplace, so workaday,
Mm-hmm.
that I didn't think it was affecting me. And I found out too late that it was, and that was I there's many reasons why I abused opiates, primarily because they felt good and my brain loved opiates. But you know, you have to go deeper than that, and you have to look at what really makes an addict an addict.
Mm-hmm.
And you know what I had to deal with primarily is well, first of all, death, and knowing that it comes to everyone eventually, and knowing that you're when it comes to a disease like this, it's the only disease that tells you don't have a disease, if you can imagine that.
Mm-hmm.
And I look at oncologists, and I'm jealous of their success rates. I'm jealous of their low mortality rates compared to my patients,
Mm-hmm.
because your disease feels good and it tells you you don't need that doctor. And what,
Right.
you know, when you've got cancer, you know what you've got to do, and you're holding on, and every breath is sacred. And when you're taking care of an addict, that's not the case. And that's why most doctors can't fathom taking care of someone that doesn't value the life that we're called to protect. That we're, first, do no harm. And it's painful to watch someone do themselves harm in the beginning, and then you learn how to deal with that. And we physicians are good at gallows humor, and good at dealing with things without stuffing them, without transmuting them into something else. Sublimation. I've gotten to know psychiatry primarily because of all the psychiatrists that I've seen. And studying for your addiction medicine boards, you've got to know some psychiatry.
Ab-
And
Absolutely.
just obviously self knowledge avails us, not everything, but not nothing. But it's not the end all and be all. You've got to be able to process this in an accepting way and in a loving way, and knowing that your patients, most of them, are not going to get it. And when you've gotten it and you've worked hard to get it, and I'm not blowing my own horn, I'm not perfect by any means, and I don't do the right thing most days. Um, but I know how to course correct, and I know to go easy on myself. And when you're an addict in your addiction, you don't do that. And there's a lot of doctors out there that are like that. And I think the addiction rate amongst physicians and really first line providers, nurse practitioners, mid levels, is upwards of 20%.
Oh,
And
wow.
those are, yeah, that's mild, moderate, severe use disorders of substances. When we have access, and it's all around us. And the entitlement to those drugs and medications can be astounding sometimes. That's how I got started. Anyway.
That's really, really hard, but it does sound like you do a great job of, balancing your life and kind of
Mhm.
noticing how that can and cannot impact you. I used to be like a full-time broadcaster. So every Sunday I would usually cover a dead body, like every Sunday. Like there's no doubt in my mind there's going to be
Wow.
a shooting Saturday night, and I'm going to go cover whoever passed. And I feel like, perhaps maybe I didn't think like it impacted me really either, because it does become part of your routine of this is just like what's around you. But I do think that it can absolutely be really hard, and you have to find like a good way to balance your life, because you are dealing with like very stressful situations, and in reporting everything's under a time crunch. So it's like, got to get this right now, otherwise, you're gonna get fired. So
Yeah.
it's a lot of anxiety and stress, and mainly why I got out of that, because I love hearing people's stories, but under on my own terms, in a sense. So that was always very stressful. But people would ask me like, "Does it make you really sad? And how do you feel?" And it was sad, absolutely. But I actually found my hardest story that I ever reported was a Thanksgiving Day story, because I just really miss my family, and it was just hard to be away from them. And that was the hardest story I've ever reported on, which is crazy when you look back at it. But I think you're obviously doing like a very great job. And that kind of leads me to my next question, which is about you mentioned it before, but we talked a little bit about mental illness and addictions. Now, how hand in hand is that? Is that pretty common that you see a lot of people who may have personality disorders or they are bipolar and they have issues and they turn to drugs to almost self-medicate themselves? Did you see that happen quite a bit in your industry?
With patients or with other physicians, with other caregivers?
With patients and also perhaps caregivers as well.
Well, it's funny that I say it that way because we are patients also.
Yeah, absolutely.
What is this? There's this line of discernment that really shouldn't exist because that's what keeps most caregivers from seeking help, because we have that same paradigm that we think we don't need help. We don't need, like, I was going to ask you about how you handled. Now, I don't want to talk about your sobriety, and you can handle this however you want with this question. But being able to have a drink or look forward to happy hour, I don't get to do that, which was hard at first. It's just commonplace now to know that there's no. I mean, happy hour is every hour. It's got to be. But so we don't rely on that finish line, because that's what used to kill us, is that, well, okay, it's the end of the day and it's me time. We don't have that. Like, is that how you handled your trauma? I mean, because there's lives behind every story that you've done, and you've got to kind of just give a little 2-minute blurb about it and then move on. Or how, I'm sure there's investigation, and you have to find out about the people behind it, but you can't get attached to every story. Imagine if those stories were patients. It's
Yeah, it was
Yeah.
hard. There was one time actually that a woman's home had been broken into, and I had knocked on her door. That was my story assigned for the day, and her husband had been shot. It was right before Christmas, and somebody was trying to steal their Christmas presents and came in and shot him in the leg. And she had a little young infant with her, and I came to get the story for the day as I was assigned, and she hugged me and like was crying and told me that I was the first person to come check in on her. So that kind of was like, oh wow, like the police haven't even been able to come here yet to kind of do their investigation. And I'm just literally a reporter trying to do my job and be there to do my job. And so like some moments like that can be a little tough where you're like, okay, and you kind of have to separate yourself out because you're really not supposed to get so attached, like you mentioned. So I think what kept me going was the timing. Like, you only have like maybe an hour to talk to this person, and then you got to go on to the next story. So I would always try to be really like kind hearted and be there for those people, because like I did feel for her. I mean, she had tears in her eyes. She really meant it when she hugged me. And I was glad that I was able to come there that day and hear her story and get that on the news so that they could catch the person. So I think that for me, it is tough, and you're usually in broadcasting in small markets, so you're away from your family and your support system. So that's why for me, I wanted to move back home and be with my support system, because I think it's really hard because you don't have anybody to kind of talk to about it at the end of the day or like decompress. So I would try to do like healthy things, like like to exercise and work out, but even things like that can become an addiction. So I found myself when I was a reporter, like sometimes doing 2 days because it was very stressful. So you can kind of get like good habits can turn into bad habits as well. But yeah, I think it is very tough being in those fields. And I think for you as a doctor, your job is to help others. So like you said, it's hard for you to become the patient as well, because you're there to help them. You're not allowed to ask for help. But you
Oh no.
can, but it can be very difficult. And I think what you do is inspirational, because like you said, it's you don't sometimes don't get those rewarding stories right away. Or you mentioned that you hear from somebody 20 years later that they're doing a lot better. So I think that your job must be very tough, but it sounds like you do have those rewarding times where you have really made a difference in other people's lives and helped them beat their addiction and put them on a path that maybe they weren't on before. So, and I kind of imagine with like the holidays coming up that some of this can be really tough, that a lot of people I know that the suicide rates actually go up around the holidays. And now with COVID, this is our first time being in a pandemic and holidays. So how are you kind of anticipating that with your patients, and what have you done in the past, I guess?
Yeah, holidays are tough
Mhm.
for people who are in their addiction and for people who are in early sobriety when they're trying to figure their way out, how to live life sober. And now they're faced with memories of what they used to do, especially during holiday times. Because for most addicts, holidays are typically not the Norman Rockwell painting that you see, or you with the family around the table. It's rarely like that, and if it is, it's typically not reality. I've never. It's funny you'd mentioned before that you seek solace with your cohort, with your family, with your social circle, and all of that. This is going to be a particularly challenging holiday season because nobody's allowed to fly, and if you are, you're scared to death that you're going to get sick. So there's going to be less of a tendency to do that. Flights for Prices for flights are up way, way, way high. So there's going to be less gathering for the holidays. So you're going to have more isolation in a time where people at least expect to be with each other. So that's going to be the tough part. And I think that's a wild card that we haven't dealt with yet. This is the first holiday season of what we've been dealing with COVID-19. And, it's still there. It's still killing people. It's going to probably thin out, most likely, from what I've seen of the numbers. And I definitely don't want the podcast to go in this direction, but I think eventually it's going to get back to normal. Not normal, just like before influenza or the Spanish flu hit. Our society changed how we looked at communicable diseases and whatnot. So, but we're going to go back to normal. Human beings have seek equilibrium, and that equilibrium is peace. And we're social creatures. We're not meant to isolate. It's my opinion. I think we do our best when when we're able to take our joy and spread it and have it amplified. When we're able to take our strife and our grief and have it muted because we're spreading it out amongst our social circle. And for people who have relied on meetings, 12-step meetings, and religious gatherings to have that ability to amplify the joy and divide the strife and the grief, we're not going to have that right now. So what we're trying to do is put things into place like online groups. I'm trying to get as many patients as possible on, and you had spoken in the beginning about beataddiction.com. What that is a comprehensive program of therapy and medication at the same time for patients with alcohol and opiate use. And those are the two main things that are killing people now. Let's not forget about alcohol. There's an alcohol epidemic. It's just not getting the press that opioids are getting. More people die from alcohol than opiates, hands down. Secondary causes, liver issues. But opioids it's a social problem that's affecting other people. Most alcoholics don't cause societal harm and cost as much as this has become in such a short period of time. And it's politically charged as well. So we're dealing with a disease within a disease. So we're dealing with addiction and mental illness within COVID-19. We don't know how that's going to act. We don't know how that's going to behave. And we can obviously prepare for the worst, expect, hope for the best kind of thing. Well, I don't think that's going to happen this holiday season. You got to be an optimist, though. I mean, you have to be. Yep, addicts and alcoholics, especially in their disease or in early sobriety, tend to be conspiracy theorists. So they're the ones that are out there that they're, trying to gain some control back in their life. And they're the ones that are probably not going to, they're the ones that are going to be going, I don't need to wear a mask. You know what I mean? Look at what I've been through so far. It would be a shame to die of COVID when you spent all this time and energy and strife to get sober. So we're trying to keep people grounded in reality with data, with evidence-based, like we usually try to practice medicine. We try to have faith in the studies that are coming out, and what I've learned over the years is that there are very few medications that we could use to treat opioid and alcohol use disorder, which is what we call them, alcoholism and drug addiction. Is naltrexone is at the core of that. And if I'm not offering that to every one of my patients, I'm doing them a disservice, especially in the early parts of their sobriety, when they first kick the booze, when they first stop drinking, when they first stop using opiates. It's like your cravings are crazy in the first 90 days. Like you've dieted, right? I mean, you tell me I can't eat a Kit Kat and I'm going to want a Kit Kat.
No, I
I
get
love Kit Kats.
I get what you're saying. And you mentioned, I kind of want to wrap up with this two last questions, which is you mentioned alcoholism. And I know that it's kind of been this, it really isn't a joke, obviously, alcoholism, but there's been a running joke that, due to COVID, a lot more people are drinking, and I'm
Mhm.
here in Chicago, and actually our liquor stores close at 9 now, but I would say like there's like a line, at like 8:45, and people are just drinking like a lot more. And so have you seen that within your patients due to COVID? Is my first question. And then my last question is, if you do know somebody who has an addiction, such as alcoholism or drug use, and you're either their friend, their family member, their boyfriend, girlfriend, wife, husband, how do you help them? How do you have that come to Jesus moment?
Yeah, so we call that moment of clarity, right? It's when they realize that they've got a problem and that they need help. You can be a What I found works best is being as open, honest, loving, and accepting of that person. Provide a safe space for them to admit they've got a problem. Because if I had that a long time ago, I think I might have asked for help sooner.
Mhm.
So be there for them. Uh, Seek the help of a certified professional. And within the physician community and mid-level provider community, there are physicians, MDs and DOs. There are psychiatrists. There are PhD therapists. There are licensed marriage and family therapists. There are LCSWs. These are all qualified therapists. Seek someone who's got addiction, a specialization, or a core treatment of their patients that are addicts or have addiction qualifications. Ask them for help, because there's language that you can use that you may not know. There's just like Spanish and French, there's a language that you have to come to someone who's got a problem with that without scaring them, without enabling them. That's also another issue. God, I wish we had another half an hour, because this is the real important stuff.
Yeah.
Just be there, be open, honest, loving. Try not to enable. You're not doing them a service by helping them continue their addiction. And it may be the hardest thing that you have to do for the holidays, but you may have to cut people off when that's the thing that they shouldn't have done for them. But if you're allowing them to drink or use drugs and pretend that everything's the same and everything's great, and let's not rock the boat, you may have to get over that. And you may not know how to do that yourself, and that's where you need to seek help. And when I was talking about naltrexone, there's medicines that can help a patient deal with the cravings that they're going to experience if they try to do this. But but there's so many people out there, and there's so much availability on telemedicine now. The rules have been let up, and we're allowed to treat people across state lines and use medications that we weren't allowed to do unless we were face to face. We don't have to do that now. This is like the best time to seek help. We can do this over the internet, and I could take care of you.
And that leads me to my last question, which is thank you for coming on. And where can we find more information about you, or if somebody would like to come see you and maybe have a telemedicine appointment?
Okay, so we talked about beataddiction.com. That's the naltrexone implant program. It's innovative. It's going to be hopefully the first FDA approved implant. There's my shameless plug. My clinic is DeSantoClinics.com, DeSantoClinics.com. I'm in Costa Mesa if you live in Southern California. If not, we can talk to each other online. You do not have to use drugs or drink ever again. You don't. You don't. And there's a community of people out here that can support you. You have no idea what's on the other side of this. please ask questions and please ask for help. That's all I got.
Thank you so much for coming on today and educating us more about addiction, and we really appreciate it. And I really feel that this is great information that we learned today. So thank you again, doctor.
Good, I'm glad. Thanks. Thanks for having me on.
All right, take care.
Take care.